Another question, and when do you know when to go up or down a dose? That's a really good question, and we get asked this a lot. So the weight loss injection medication, you increase the dose over time. Now, Wegovy is one of the types of injections and Mounjaro is the other, and each have a different dose. At a minimum, you need to do each dose for 4 weeks, and each pen that you get is a fixed dose and is 4 doses. So, sorry, four, can't count, 4 doses. So it lasts 4 weeks. Okay. So at a minimum, that is, you need to do those 4 injections at that dose. That gives your body a chance to get used to the medication and a chance for you to see not only your weight loss results, how well you're tolerating it, and if you experience any side effects or unwanted effects. If all is going well after you've done those 4 injections at that dose, you can go up in dose. But it's always what we say is have a think. Do you need to go up in dose? Are you feeling in control of your appetite, which is what the drug does? And are you losing weight? If you are, you could stay at that dose and do another 4 weeks at that same dose. Or if you feel, actually, do you know what? I'm still not quite there. I feel like I'm still getting a bit snacky at times, or I still don't feel like I'm making the best dietary choices, or it could be a time to actually go up in dose. And that's fine, as long as you don't have any niggly side effects. So if you're experiencing a side effect from the dose, like you've maybe got some nausea that's not going away, or it's upset your bowel motions, you're maybe a bit loose or a bit constipated, and those haven't got much better over the 4 weeks, sometimes it can be worth repeating the same dose again before you then go up. So there's those 2 points to look at: how you're tolerating the medication, how your weight loss is going, and how your appetite's controlled. At a minimum, you need to do a month or 4 doses of each dose, and then you can go up. However, it is not a race to get to the top dose, and just getting to the top dose doesn't mean you'll get the best weight loss results there. You start losing weight effectively right from the beginning. The dose that's right for you and the most effective for you is the one that's working. Every patient differs. Some people titrate or move up the doses quickly. So every 4 weeks they move up, and that suits them and their body and their goals. Other people stay on the lower doses for a long time. Some people stay on the bottom dose the entire time. There is no set rule, except for making sure that you do at least 4 injections of each dose before you consider moving up. So I hope that answers your question. But the reason that it's like this is because the way these drugs work, the injections work, is like our weight loss tablets. They have an effect on the appetite control center in your brain, but they also have a direct effect on the gut. And if you go up in dose too soon, either without doing four doses, or you have a side effect and you move up, sometimes that causes gut disruption and can make you feel bloated or nauseous, or have unwanted side effects, which actually, if you just stayed on the same dose for a little bit longer, wouldn't happen as you go up. But also, again, if there is a niggling side effect that isn't settling, then the injection that you might be on might not be the best for you, and actually the other one might suit you better. Although they're the same classes of drugs, they are different drugs. So if one doesn't quite suit you, the other one might. So again, it's worth thinking about that when you're looking at the landscape. But the key is this medication is helping you lose weight and be in control of your appetite. If it's doing those 2 things, then it's working.